General myths about dentistry. Removal of upper teeth affects vision. There is a myth among many people that removal of the upper teeth affects vision. This is a misconception. Vision is not affected in any way by undertaking treatment of the upper teeth, including its extraction, since teeth are no way connected to the eye nerves. An artificial set of teeth or complete denture that is made once is forever. While it is true that well-fitting dentures are used by the patient for many years, it is a myth that it can be retained forever. The oral tissues that lie below the dentures change over a period of time. But the dentures are made of stiff materials that do not adapt according to the changing contours of the oral tissues. Thus, even a well-fitting denture may not fit well after a few years. If an ill-fitting denture is continued to be worn, it can cause damage to the underlying tissues. Therefore, dentists advise changing of the dentures once in at least 5 years. Once a decayed tooth is treated, the dental problem is over. This is not true. Dental decay is treated by use of various restorative materials. However, the artificial material usually will not completely match the tooth in strength, color, smoothness and other qualities. In addition, if the patient does not maintain good oral hygiene, decay can start again around restorations. Hence, whenever a tooth is filled or replaced, it requires use of additional cleaning methods like flossing, in addition to regular toothbrushing. Professional cleaning, scaling, removal of tartar loosens the teeth. Professional cleaning removes the tartar from the gaps surrounding the teeth and stops further destruction of supporting bone. Therefore, removal of tartar deposits does not loosen the teeth but helps to recover the health of teeth. Dental procedures are always painful. Most dental procedures are carried out under local anesthesia, which makes the procedures totally painless. In addition, the modern-day high-speed drills cause less vibration and are more comfortable for the patients. Dental treatment should be avoided during pregnancy. This is not true. Many a times, a dental treatment is provided even during late pregnancy. Routine dental procedures can be carried out without any fear. However, major surgical procedures may require medical opinion before treatment. Dental X-rays are to be avoided during the first 3 months of pregnancy. Cleaning the teeth with finger and powder is better than with toothbrush. A toothbrush has long bristles that reach almost all the surfaces and corners of the teeth to clean plaque and food particles. A finger may not reach all the areas where a brush can. Therefore, it is recommended to use a toothbrush with paste to clean the teeth and freshen up the mouth. Finger can only be used to massage the gums after brushing is complete. A child never needs cleaning of milk teeth. It is a myth that we need not clean a child's teeth. Children are as much prone to dental decay or gum disease as adults. In fact, children tend to have sweet food including sweetened milk and juices which can promote dental caries. So it is advisable to start the habit of cleaning the infant's teeth soon after they appear in the mouth. In fact, it is advised to clean baby's gum pads every day by gentle massage even before the teeth erupt. Milk teeth need not be taken care of, as they last only for a few years, and these teeth will anyways be replaced by permanent teeth. Early loss of milk teeth will interfere with chewing and affect the child's nutrition. Early loss of milk teeth leads to drifting of the adjacent teeth and closure of some of the space that is required for the succeeding permanent teeth to erupt. Such a loss of space will cause the permanent teeth to erupt in irregular position and result in crowding. Therefore, milk teeth need to be taken care of as much as permanent teeth. When the gums bleed, it is better not to brush the teeth. Bleeding of gums is a sign that they are inflamed and are not healthy. This usually is a result of plaque and food particles accumulating around the teeth. Until this collection is not removed, the gums continue to bleed. This is an indication that the individual needs to visit a dentist for opinion and treatment. Brushing the teeth with a soft toothbrush by the proper technique removes the plaque and helps the gums recover. Initial bleeding seen during brushing gradually reduces over a period of time. Keeping an aspirin tablet beside a painful tooth reduces the tooth pain. A toothache cannot be relieved by placing an aspirin tablet anywhere in the mouth. In fact, this is a dangerous habit as it causes burns of the soft tissue around the area of placement. Hence, aspirin tablets should not be placed in mouth but swallowed after eating some food to relieve the pain. Does using a toothpick widen the gap between teeth? No. Using a toothpick does not cause gaps between teeth. You can use a plastic or wood toothpick but not a metal pin, as it may cause an infection